Hi, welcome. My name is Dr. Cindy Miller, and today I'm going to be sharing with you 10 study tips that you could use in your science courses, such as physiology. Now, this presentation is going to be tailored for students in professional programs such as medical, dental, or graduate schools, but the same tips should also be applicable to students at all levels of their educational careers. Now, the reason why I wanted to create this video was because students often come to me for advice on how to best study for their courses. They recognize that those study skills that they use for their undergraduate courses may not be effective at this level, but they need some specific tips that they can use and implement in their own study skills. So, these tips are created from things that I learned as a student not so long ago, but also from my experience in mentoring students and the best way to approach their coursework. So before we get started, there are some disclaimers that I'd like to give to you. And one of these is that these are only suggestions, but the way that you study and the way that you learn is going to be a very individualized experience. So you may find that some of these tips work very well for you and others don't, and so you'll have to experiment with each of them to see what the best fit is for you. Now, the other thing that you're probably going to notice is that these suggestions are really mind-blowingly simple. But what we see is that there's a lot of academic research out there that supports their use. And often what I see is students are coming to my office or catching up with me in the hallway and reporting that they are making these mistakes and they need to revise what they're doing. And so these are very common issues that I see with all professional students. And so the tips tend to be very helpful for them, even as simple as they are. So to get started, I want you to think about this question. How many hours do you plan to study per 1 hour of lecture in your program? So you sit through class for one lecture hour. How many hours are you going to spend at home or in the library studying for that lecture hour? And interestingly, what a lot of students say is when they go into professional school, what they're going to do is just study more per each hour that they're in lecture because they recognize that the content is going to be more challenging. But what I want you to appreciate is that in a typical professional school, there's going to be a very large number of lecture hours each week. So I went through a couple of years ago and calculated this out for the School of Medicine here at the University of Louisville. And what I found was the students are on average in class about 25 hours per week. And so I asked them, well, how many hours do you plan to study per each hour of lecture? And students on average said that they were going to study upwards of 7 hours per hour of lecture. So let's look at whether that's realistic or not. So we'll take 25 multiplied by your stated study hours, which on average students report to be about 7 hours per hour of lecture. And that gives you 175 hours per week, and then we'll add back in the time that you're actually spending in class, so about 25 hours a week. And that leaves us with 200 hours per week that you would either spend in class or studying. And so if we look at reality, we see that there's only 168 hours per week, and we would expect to spend about 49 of those hopefully sleeping. And so that only leaves us with 119 hours, not including the time that you have to spend eating and commuting and so forth. And so what you can see is this is really an unrealistic plan that you're going to increase your number of study hours. And so one of the things that I do is I lead a summer pre-matriculation program for what we would consider to be students that might be at risk or disadvantaged in some way entering into medical school. And so we have them start looking at their study plans and how these may or may not be reasonable. So if we look at the data from those studies, what you can see is that students on average spend a little bit more than 7 hours per hour of lecture in their undergraduate careers studying, and then they plan to increase that, although there is a large variance once they get into medical school. And so if you look at this in the span of a typical week, and we look at this solid black line as representing how many hours there actually are in a week, you can see that those initial plans when they enter into the program is very unrealistic. It's well above the actual number of hours in a week. And so as we go through this program and we start looking at these tips that we use for studying, you can see that students go down to a more realistic expectation of how they're going to be studying. And so generally you only have about 3 to 4 hours to study for each hour of lecture that you're receiving. And so you have to think about creating a realistic study plan for yourself in which you're learning very complex information, but in a very succinct way. So you have to study smarter, not harder. Okay, so let's look at another question. How many times do you think that you should read your notes prior to an exam? Do you think you don't need to read them if you're listening to the lectures? Perhaps you're getting those lectures pre-recorded on a system. Or do you think you should read them 1, 2, 3, 4, or more times? Well, what I found is that a lot of students, when they're studying material and it's very complex, the mechanism that they'll use to study is they're just going to read it over and over and over again, hoping that that material sinks in. But my tip number 2 is that reading and reading again and reading over again is not going to be a very effective method for you in professional programs. And another thing that I'd like to say is this is really the same thing as saying listening and listening again. Students often tend to listen to our lecture recordings over and over again, and that's also not a very effective method of studying. So if we look at this in a numbers context, I went through and counted there's 1,427 slides in our medical physiology class. So if you spent 5 minutes per slide both looking at that slide and reading the accompanying notes, it would take you 120 hours just to read that content once. And so if your mechanism is just reading and reading and reading over again, that's going to be a huge time waste. And you're also not going to be really understanding, well, how much of this content have I truly learned? Just exposing yourself to the content may not mean that you've actually mastered it. And so my tip number 2 is I really want you to think about focusing on retrieval of information and becoming an active reader. So instead of sitting there and just reading the content over again, I want you to focus on how much of this content have I actually learned. So put those notes away. Jot out some things about what you just learned or create a diagram. You should never be sitting and just reading. You should be very active in how you're approaching the information. We're going to see some more tips as we go through on how to do that. Okay, so let's look at a sample here. So this is a typical page from your notes. And so we can see that we're looking at the different determinants of arterial blood pressure. And what I want you to do is read through this short little snippet and tell me, what do you think the professor would test you on? Okay, so what I found is the natural tendency for most students is they dive really far into the content to start with. So they're thinking, what are those fine details that the professor is going to test me on? And I actually saw this recently with a student that came to my office hours and was wanting to know how to approach a particular question that came from an exam, and they were very frustrated because they were trying to learn exactly how the aortic compliance would affect the diastolic pressure in this case. And so I started talking with the student and asked them to take a big step back and really think about what was the big picture here. And what we realized is while that student was explaining things to me is that they didn't have a very good grasp of what diastolic blood pressure even was. They had really skipped a lot of steps and dove straight into the material without a good comprehension of what I would refer to as that big picture. So I always encourage students when you're first approaching content to really think about what is the big picture, and then from that you can start to fill in the small details. This is really important because what you're going to find is you're under that time constraint. So if you start with the small details, you're simply going to run out of time to get the big picture. And you're also not going to be able to apply that content to new situations, which is what a lot of our professional curriculum is going to ask you to do. So an analogy I use is this piece of art. What they did was they actually did an interesting experiment where they showed this piece of art to split brain patients. So these were epileptic patients in which surgeons had severed the corpus callosum that allows the two hemispheres of the brain to communicate. And so if they showed this picture through one eye to one hemisphere of the brain, the individual reported that they saw a face, but no fruit or vegetables or flowers. If they showed the picture to the other hemisphere of the brain, Then they would see the fruit and the flowers and the vegetables, but they would not be able to recognize that the picture was also of a face. And so since you have an intact corpus callosum, most likely, what I would really want you to do is first start with that big picture. What is the entire picture of? And then you can start diving into those small details. And that's a good approach for you to take in your studying. Okay, so that brings us to tip number 4, and that is organize. Anytime you can take a large amount of content and put that in a very succinct fashion, it's going to be such a time saver for you. So as an example of that, here in the bottom left-hand corner, I remember that when I was a student and we were going through endocrinology, I was having a really tough time remembering which of the endocrine hormones caused which effects on metabolism. And so as a student, I took the time to make this table, and once I put it into this form, I started to recognize that there were some very specific patterns. And so once you see those patterns, it takes a large amount of content and really condenses it. So anytime you can take your notes, put those aside, get out your own piece of paper and make a new diagram or make a comparison chart. This is going to help you to really master the material in a much easier fashion than if you're just reading and trying to memorize isolated facts. Okay. What you can also do when you're studying is to use visual cues. So perhaps when you're studying different systems of physiology, you might want to put your notes on different colors of paper. You may say, well, I don't really know how helpful that would be. So let's look at an example of that. Let's say that you were studying ion transport. So something that's very integral to physiology. And so you started off with the first subject in physiology where you were looking at the production of cerebrospinal fluid in the choroid plexus. And you can see that there's a large number of transporters in that apical and basolateral membrane that you have to remember exactly where they are and how they're moving ions. And so you might be able to just from rote memorization to look at that and remember for a short period of time what's happening there. But then let's say that you go to the next subject and you're looking at the renal physiology. Now we're in the proximal tubule and you see there's different transporters here. And then we go to the thick ascending limb of the loop of Henle and the nephron, and there's different transporters there, and so on and so forth as you proceed through physiology. So you can start to see where these same basic concepts can get very muddied once you start going through the different content areas. So if you have those on different colored pieces of paper or written in a different color of ink, this is going to be a visual cue to you that will help trigger in your brain, wait, I remember that was on a yellow piece of paper. And so this will really help you when you start to integrate everything, particularly for final exams or board exams as well. Okay, so those are some basic tips to help you as you get started with learning the content. And then what I would encourage you to do is to really start studying with classmates. Now, this is something that I think is really difficult for students when they first go into professional school, because what we've experienced in undergraduate courses is most of the time groups just tend to procrastinate together. But what you'll find in most of your professional schools is you all have a common goal. It's no longer a competitive environment. It's supposed to be very collaborative. And you've got a great deal of resources sitting around you in the classroom. Oftentimes these classes are very large. Here we have classes of 120, 160 in our professional programs. And so there's usually one professor for all of those students. And so you are going to have to rely on your classmates. And you'll find that once you start teaching the material to one another, that's going to be a much more efficient way and a long-lasting way of learning the material. Now, a lot of students want to wait until they're completely comfortable on their own with the material before going to their classmates, but oftentimes they find that they'll run out of time before an exam if that's the approach that they're taking. So start early. Once you go to the lecture, start talking with your classmates about what you think is going on and how you would approach studying the material. The earlier you can start that, the better it's going to be for your performance. Now, tip number 7 is actually my favorite, and it's the one that I felt like really helped me the most when I was in graduate school obtaining my PhD in physiology. So, what we often see is each of the professors is going to list some learning objectives for you. So it's a list of things, perhaps it's in the form of a study guide, that at the end of this section they would expect that you would be able to do. And I think the natural tendency of students is just to say, okay, yeah, I remember when they talked about that. I'm probably good with this subject. But a lot of times you remember that if you're just reading or listening to the lectures, you may not have a good feedback loop on how you're actually doing in the course. So you're actually lacking some formative assessment before that summative assessment of the exam on whether you've actually got the content or not. And what I found is the better the lecture is and the better they're able to engage you in the course, the more of an issue this is because you trick yourself into thinking you know the content when you don't. So what I suggest students to do is take that learning objective, put your notes aside, close your textbook, and see, can I actually answer that? And so this is an excerpt from one of my notebooks that I had in graduate school. So a lot of times what you'll see is in the middle of this, you'll realize like, oh, there was an area where I thought I understood the concept, but now I'm starting to struggle. And so what I would often encourage you to do is once you get completed, take your notes back out, take your red ink pen, and grade yourself. See, are there areas where I thought I understood the content and I didn't? Or are there areas where I've really got to strengthen this? I've already mastered the material and I need to move on to my next learning objective. And so you may have to do this several times until you feel comfortable with all of the material. It seems like this would take a great deal of time, but I want to really encourage you to try this out because it's a much better way of focusing on that active retrieval and seeing how much content you've actually mastered at any given point in time. Okay, so speaking of points and times, I want you to tell me, what time of day do you study most effectively? Are you an early bird or a night owl or somewhere in the middle? So oftentimes people feel very strongly about this, where they think that they study more effectively in the morning versus night or in the afternoon. And I'll say that that's fine. I think that there are probably individualized differences in that, and I'm not going to discourage you from studying at what time of day best fits into your schedule or which time you think is most effective for you. But what I would encourage you to do is take some time each night and read a little bit of the content before bed. What neuroscientists have found is that the last things that you think about or study right before you go to sleep tend to really be the things where we really form those strong synapses between neurons and memorize the information very well, particularly if it's something that you think is going to be important in your future. So as you approach your exam or as you become a physician or a dentist, those are the things that your brain is going to selectively choose to actually program in and make sure that you form those memories very well. So as a side note, this is often really helpful because many times physiology notes tend to induce sleepiness anyway. And so you can use that to help you fall asleep each night. And oftentimes you'll sometimes wake up in the morning still thinking about the physiology that you read before you went to bed. So really think about that. You might just, don't do a lot of content right before you try to fall asleep, but going through some of the things that you've looked at that day might be helpful for you. So along this line of sleep, let me ask, how many hours of sleep do you expect to get per night when you're in professional school? I asked this question to some students in my summer pre-matriculation program, and what the majority of them reported was that they plan to probably get about 6 hours per night. And if you ask the students, they said, well, we know that 8 hours is optimal, but 6 hours is probably pretty good for students, and that should still allow me enough time to study and yet get the sleep that I need. But I really want you to think about the fact that you should not stop sleeping. And I should caution you, I'm not saying that you should be like Sleeping Beauty here, this is one of my students that was in my course this past year. But I'm saying when you're at home, you shouldn't be reducing your sleep hours. And you might say, well, how important is this really? Well, there was an interesting sleep study that they did where what they did was they took healthy young participants and they assigned them. They said this group is going to sleep 4 hours a night for 2 weeks, or this group is doing 6 hours or 8 hours of sleep for 2 weeks. So just 14 days, relatively short time span. And then they gave them some cognitive performance tests. So these are, basic memory things or basic performance tests where you have to recall basic information while they were awake. And they also asked the subjects to rate their own sleepiness on a scale. So just how sleepy do you feel at this moment while you're trying to complete this test? So as you can imagine, those participants that were in the 8-hour time point, they did very well on the performance test and had very low levels of sleepiness. And as you also might imagine, the 4 and 6 hours actually had a pretty drastic reduction in their performance on these cognitive tests. So for the 4 and 6 hour time points, when they asked them to rate their own sleepiness, surprisingly, they basically reported that they were feeling just fine. So there was really this contrast between the fact that their performance cognitively was down, but the subjects weren't actually reporting that they felt sleepy. So even though you might be someone who says, oh, I can sleep 6 hours a night and perform just fine, you're actually probably hurting yourself. And keep in mind, these were on pretty simple recall tests. The things that you're going to be asking to do to develop your critical thinking and your problem solving skills in professional school are going to be quite a bit more advanced. And so even though 6 hours of sleep may seem sufficient for you, you're probably actually hurting your performance quite drastically by reducing the amount of sleep that you're getting. And in fact, what they found with the 6 hour time point was that cognitively, that those participants were performing just as poorly as those that were deprived of sleep for a full 24 hours. And so you want to make sure that you're getting an appropriate amount of sleep throughout professional school. Okay, so now you've hopefully gone through all those tips. What I would encourage you to do with our last tip is before the exams, create a little checklist for yourself of things that perhaps as you're approaching the material still having trouble remembering. So this is something that I did for every section. The night before the exam, I would give myself a specific cutoff time where I would stop studying and start trying to sleep. And then the morning before the exam, I would look through my last minute checklist just to help to get those things that perhaps you're still struggling with in some short-term memory right before the exam. And then you can also use those same checklists as you approach final exams or your board exams as well. So hopefully these tips will prove effective for you as you approach your professional program. I wish you all the best of luck in your studying, and I appreciate your time and attention today.